Moving on to the head, eyes, ears, nose, and throat exam. We would just want to check his eyes and make sure again that the pupils are reactive to light. We could check for that red eye reflex that could identify any problems with his cornea or lens. Check the conjunctiva just to make sure there's no redness or inflammation, color of the sclera, make sure that he is able to follow objects and that he is seeing somewhat clearly. And then if there's presence of tears. So by this age, he should be able to produce tears, and he does. So head, again, we're just looking for symmetry, making sure that it's equal on both sides. We're checking head circumference, no edema or lesions on his scalp. For ears, again, checking shape, making sure they're symmetrical on both sides of his head. Any external trauma that we might notice, we'd want to know. And then if we had an otoscope, we could look in his ear and make sure there were no signs of ear infection. Other signs of that might be him pulling on his ear, being more irritable or restless than normal. For the nose, again, just that it's symmetrical and patent. Right now, he's a little stuffed up, so you can kind of hear him gurgling a little bit. But just looking at mucous membranes and making sure that they're moist and pink, no swelling or cracking or anything like that, right? And then for the throat, again, just mucous membranes, looking at teeth. By this age, at 10 months old, they should have a few teeth popping through probably, and he has 6. Yeah, yes you do. Just looking at gums, making sure that they're not inflamed or overgrown, any excessive fluids or secretions. If he was drooling a lot or something like that, we might be concerned. And then if I had a gloved hand, just checking his palate to make sure that the palate is intact with no problems. Okay, stop.